I think it's wonderful to see concrete examples of CK's thinking when a manager like Mr. Sharma can tell us about products and services that reflect that philosophy, and we see them crisply in examples. Our second speaker is Dr. Michael Fuerst. He is the manager for integrity and corporate citizenship at Novartis International. He's initiated programs to realize the principles of social responsibility and ethics in his company. Dr. Fuerst.
So, thanks. It was in '99 at the World Economic Forum in Davos. Kofi Annan, the UN General Secretary, he approached Daniel Vasella, our CEO at this time, and he asked whether we would like to join the UN Global Compact. UN Global Compact, at this time, 9 principles, based on the idea of trying to reduce the negative impact of business in the societies. Daniel Vasella, he was quite positive about it, and we joined. And based on this commitment, Novartis has started a lot of initiatives in the area of corporate citizenship. Of course, mainly related to our core competencies, and this is developing drugs. So, as an example, we are providing more than 80 million antimalarials a year, mostly to sub-Saharan Africa. And you just should keep in mind that still today, every 45 seconds, a child is dying because of a malaria infection. So that's a huge disease burden. We have a nice product, a fantastic product in our portfolio, and we give this at cost. And we have some other initiatives in our CSR portfolio. However, there was a feeling that came up over time that maybe this is not sustainable. This is based on the idea of philanthropy. This is a donation. And that's good. For a certain segment in the pyramid, I believe it's the adequate thing to do. It's the appropriate thing, because for the poorest of the poor, where you have no commercial opportunities, you should maybe do donations or philanthropy. But with the move into the emerging markets, it became more and more obvious that there's an interesting commercial opportunity for a company like Novartis. And unfortunately, I have to admit that I've never met C.K. Prahalad. I read a lot of him. I don't know whether our senior management has met him. I could imagine, but I don't know. But still, the idea of going to the bottom of the pyramid and trying to do business there and help people that are suffering because they have health issues was quite an influential thought. And what I'm trying to do is I will try to show you how we embarked on the journey to go into bottom of the pyramid business. And I will focus there on a very specific initiative that we have in India. Now, what is very clear, when you are a health company, it's obvious that you have a big impact on society, because health is influencing the economic prosperity of a society. So you're an important stakeholder when we talk about economic welfare and growth in a society. Now, very often people think, yes, people need health products, but there is no market. But when you just look at the data of the World Resource Institute from 2007, it becomes very obvious that people in the bottom of the pyramid are spending roughly $158 billion a year into this segment, and on pharmaceuticals alone, 57 billion. This is data from 2007, so I'm sure that this has grown in the meantime. I'm just showing you this to explain that it's very necessary to demystify the idea that there is no commercial opportunity and no income that can be spent in health. But what is also very clear when we talk about health, it's not only about the product. The product is one issue that is relevant when we talk about health outcomes. But it's very much about water, for instance, about sanitation, and about nutrition. And when you think about bottom of the pyramid business, I believe we have to think about cross-sectoral solutions. So for us, this is a call to think about water, clean water, sanitation, and maybe also about nutrition, to put this or amend our portfolio with these kind of products. This is a thought we are having. This is currently not done, but I believe when we really want to drive health outcomes, this is something important to be considered. And what is also very clear to us is the fact that when you look at the health challenge in the world, it's absolutely clear that philanthropy will not solve this issue because the challenge is just too huge. And no one can write so many checks that we can help people with donations and philanthropy. Now, when you go to a market like India or Philippines or Vietnam, you can have a fantastic product in your portfolio, but it doesn't really help because the only drug that helps a patient is the one that he swallows. So when we talk about health outcomes, and that's important to understand when we talk about bottom of the pyramid business models, we have to look at the whole ecosystem of a patient. So is there a health service available in a rural village in India? Is there a doctor available? Is there a nurse available? Or does the patient has to travel a whole day in order to get the treatment and the diagnosis he needs? That's an issue you have to consider. Now, if you come to the conclusion that there is no health service available in the rural village, the next thing is you have to think about how the patient reaches the next health facility, maybe in the next city. And just try to understand that typical villagers don't want to travel far. First of all, because it's a loss of income. And secondly, it's also very uncomfortable to leave their village. That's their normal way of living. So you have to think about infrastructure. Can you maybe find ways to bring the health delivery to the patient and not let them travel? Thirdly, of course, you have to think about the affordability, about the prices of your drugs that you're providing to the patients that are in need. And last but not least, it's about quality of care and awareness. And especially in bottom of the pyramid situations, you see very often that patients have a lack of health awareness. They're not aware about disease symptoms. They are not aware about treatment options. So you also have to think about this issue if you really want to help the patients and also drive business there. Now, what I will do now is to show how we are trying to approach these different factors with a holistic model. And that's Arogya Parivar, which means healthy families. It's Hindi. Just a little look at India in order to make the challenge clear. When we talk about India, 2/3 of the population is living in rural villages, very often in very poor situations. If you look at the spending on health compared to other countries, it's comparably low. And if you look at the situation of paying for healthcare services, most payments are done out of pocket. So people have to earn what they give into healthcare. Now, when you look into the specifics of the bottom of the pyramid, you see very often that there's a low health-seeking behavior. Getting sick is a fate. It just happens. You don't do anything about it. Especially, this is a problem with women. So we have to look at disease awareness in order to drive this health-seeking behavior. What is also, of course, very, very important is the unsafe drinking water situation and the poor sanitation, and as mentioned before, the suboptimal local healthcare infrastructure. Now, what have we done? We have looked at the market, at the bottom of the pyramid market, from a holistic perspective, and we started to do this in 2007. We looked, first of all, at our portfolio. So we looked at the supply side of our business. And we said, what are the most common diseases in India? And do we have the right products to match these diseases? Do we have the right product in our portfolios? And luckily, we had the right products in our portfolio. So meanwhile, we are having 80 different products in our portfolio of Arogia Parivar, and we are covering 12 disease areas. And again, this is selected on the disease burden in rural areas of India. Now, again, another thing is the pricing. So we are a diversified company, and this gave us the opportunity to sell high quality but low cost generics to the population. We also have OTC products, over-the-counter products in our portfolio of Arogia Parivar, pharma products, and we also started to include vaccines into the portfolio, which is very important, of course, in terms of public health. Now, what we have done, because India is such a diverse country, we had to adapt the local languages on the packages in order to enable the patients to understand what they have to read on the package. So we have rebranded the packages based on the local dialects. And we have also cut down the size of the package, because it doesn't help if you have a package of 20 and the patient can only pay one a day. So you have to completely reconfigure how you go to market from a supply chain perspective. But then there's also a demand equation, of course, when you want to do business. And this demand is very much driven, as said, by disease awareness and education. So what we are doing there, we have hired so-called local health educators. These local health educators are coming from the communities. This is giving them credibility, and of course, they are paid by us, so the income stays in the community, in the village. These health educators, they go from village to village, and they organize on a daily basis so-called health education camps, where they talk with the villagers about typical disease patterns, about treatment options, etc. Now, to be very clear, this is done in a completely unbranded way. We don't talk about Novartis products. We talk about disease awareness and about training, and not about our products here. Focus is prevention, child and maternal health, because I said this is one of the big focus areas in rural India. Now, what we are also doing is, next to these health educators, we have so-called supervisors. And the supervisors, they are going from doctor to doctor, from pharmacist to pharmacist. They are giving them training, because sometimes the medical education in rural India is not as good as it should be. So they are giving them some sort of training, and they are also detailing our products to the pharmacists and to the doctors, so that the supply chain is ensured. So when a patient goes to a doctor and he gets a diagnosis, that the doctor can prescribe and hand out the right medication the patient needs. So what you're seeing here is that we are trying to develop a model that is looking at the supply side, but also on the demand side, and is trying to touch all the critical issues that are driving health outcomes.
5 minutes.
Okay. Now, what are the results? As said, we started in 2007, and what I've heard from the people that have started this in 2007, they told me that we have been quite clueless what is going on there. So we had to go through a hard time. We went from village to village and tried to understand what is really driving the situation, and how can we build a model that is helping the patient there, and also driving benefit for us, because we are talking about social business. So what have we achieved in the meantime? We are, meanwhile, present in 11 states in India. We are reaching more than 29,000 villages in India. And in these 29,000 villages, more than 42 million residents are living there. So we have increased our patient reach quite dramatically with this model. It's the only model from which I know in the pharmaceutical industry that has achieved such a reach and scale. We are partnering with more than 39,000 pharmacists and clinics in the meantime. And what is the good story for us, next to the increased health outcomes for the patient, is, of course, that we have broken even after roughly 30 years, after the third year, which is very important for us, because now we can show that you can do business in the bottom of the pyramid, providing better health outcomes for the patients, but also doing good for the company. Because we believe that this is a successful model that has to be adapted in other countries, of course, we are now piloting this model in other regions of the world too. So currently we are looking into Asia and also in Africa. We are trying to do this. And hopefully, if it shows that it can also be successful there, it will be a global phenomenon, of course. What we're also looking into is into microfinance, because we have seen that even if you have a doctor in a local community, sometimes he doesn't have the right diagnostic equipment. So we thought, what is a way to provide him with the right working capital that he can buy the diagnostic equipment so that he can do the right diagnosis for the patient? Or some pharmacists are lacking working capital, and we are thinking, is there a way by providing them loans so that they can buy the stock they need? These are things we are considering currently, and we are trying to partner with microfinance institutions because the loans should never come from us. That's very clear. Now, what are the challenges and the opportunities and also the lessons learned in this journey? What is very clear for us is that you have to completely reconfigure how you go to market when you talk about the bottom of the pyramid business. And that's a tough thing for business, because business is doing very well. Pharmaceutical industry is doing very well. So why should we change? Why should we? And if you are a manager that just has to manage his own P&L, why should he change? He has to look that he brings the numbers for tomorrow. So that's a clear call for action, but it's difficult to handle inside of a company. Now, what we have also seen is that when you go to the bottom of the pyramid, you have to reconfigure your organizational setup. It doesn't make sense that you run, in my opinion, a BOP model, a social business initiative, in a public affairs or in a communications or even a corporate citizenship department. It should be run by the business. They are the business guys, they know how to do business, we help them to better understand the market conditions, but they know how to manage the business. And we have put this social business initiative into our commercial operations. And this works very well. They have tensions, of course, with traditional business there, but it works much better as if it would be on the sideline in a corporate citizenship function, for an example. Now, what we have seen is very clearly that understanding these markets needs new management competencies. And a lot of Western companies don't have these competencies. So what we are trying to do at the moment is to build up a competency set so that our future leaders understand the market conditions. They understand the limitations, the restrictions, the needs on the ground, not from textbook, on the ground, so that they're able to do business there. And just as an example, how we do this, we have a program that we call Entrepreneurial Leadership Program. And in this program, we are sending our top talents for 4 weeks into a rural situation where they have to solve with their business skills a social/business challenge. And they have to develop a business model with which they come back and they offer it to the local organization and say, that's how you could do social business in this market. And through this learning, of course, they are much better enabled to do business in emerging markets, which are a big focus of our company. So that's just the way how we drive to change these, how we try to drive these management competencies. And last but not least, when you do social business, you need a clear alignment with the business objectives of the company. It cannot be that a manager is just accountable for making the numbers for tomorrow, and on the other hand, you expect from him doing business in the bottom of the pyramid where the cycles are at least 3 years, as we have seen. This is not fair, and this doesn't work. So if you are serious about it, you have to look for an alignment with the objectives in the organization. And then, of course, I believe you have a strong articulation of the strategic rationale of your company. So what I tried to show you is a little bit what is the ecosystem of a pharmaceutical company like Novartis, how can you drive health outcomes for the patients, and how we are doing this with one of our initiatives, Arogya Parivar. So thanks a lot for listening, and I'm happy to have discussion with you.